Governor, nice to see you. And
thanks, Greta.
The Commonwealth of Virginia, you're taking on the big guys. You're taking on the feds.
In healthcare?
Yeah.
It's there's a number of things that we're looking at that we're trying to restore some meaning to the 10th Amendment, and frankly, just to try to do locally what's best for the people of Virginia. Mr. Jefferson said the government closest to the people governs best. Well, that's Richmond and not Washington. So, yeah, the federal health care bill, it's about health care, but the lawsuit that we have filed is really more about what is the balance of power between the state and the federal government. Is the Commerce Clause so broad that it could have a mandate by Congress that would deprive you of your property if you fail to buy insurance? And so that's what's at stake here. And I think over these next months and years, we're going to have a very robust debate in this country about what are the limits of federal power. What does the 10th Amendment mean? And if it means something, let's get it restored to rebalance the state-federal power.
What's sort of interesting, because you have the health care battle, and and in the course of the health care battle, you do have sort of the states, the Commonwealth of Virginia as well, sort of rising up almost against the power of the big federal government, and that seems to be sort of a shift that we haven't seen much of that lately.
No, I think for probably 60, 70 years, the federal courts have upheld acts of both Democrat and Republican Congress that have probably, in my view, overstepped the bounds that Madison and Jefferson and Mason put in place some 230 years ago. And so this is what you're seeing now, particularly with this rapid march to the left that this Congress has taken over the last couple of years with things like health care and other unfunded mandates and micromanaging the free enterprise system, trying to get cap and trade and card check and all these other acts put in place. You do see governors, frankly, Republican and Democrats, saying, look, we cannot sustain these kind of unfunded mandates. We don't think it's good legislating from Washington in a one-size-fits-all, top-to-bottom approach. We've got to be able to have a little bit more latitude at the states to be able to govern our own people the way we think is right. So that's what a lot of this is about.
Is it more about states' rights and the 10th Amendment, or is it about financial pressure and the pain that it may inflict on certain states?
Well, it's both, and the health care is a perfect example of that. The reason we filed suit is because we think the Congress has overstepped its bounds on the Commerce Clause to be able to tell individual citizens of any state that you must buy insurance or get fined.
So you'd do it anyway, even if it didn't cost you a dime?
Well, yeah, it's a matter of principle, and it's a matter of federalism. But beyond that, it's darn expensive. We've estimated here in Virginia that unfunded mandate in the health care bill, by the dramatic expansion of Medicaid eligibility that they're putting on Virginia, will cost us about $1.7 billion by the year 2022. The big numbers kick in January of 2014, but during that period of time, another $1.5 billion plus in spending, when Medicaid spending is already 20% of our budget, having grown 1,600% over the last 25 years because of other mandates. It's an unsustainable level of spending, so that's why we're engaged.
As I understand, the Medicaid rules will blossom under the new health care. Is that right?
Absolutely.
Okay. Right now, those people that aren't on the Medicaid rules, because the statute hasn't kicked in, who's paying for their medical bills now? Because many of them do get medical care. I mean, someone's picking up the cost now.
Well, the rules will elevate coverage under Medicaid to about 133% of the poverty level. So some people could be actually getting it through their employer now, potentially, but they're just lower income employees. Some might be getting it at free clinics. Some might be just not having care at all. When they're really sick, they're going to the emergency room. Some might be paying out of their own pockets. So it's a variety of things. But all that, and hundreds of thousands of new people now, will be eligible for Medicaid in Virginia come January of 2014. And the federal government requires it, but doesn't provide really much money at all, except in the early years as a little transitional money. And so we're going to have a significant price tag that's being passed on to the taxpayers of Virginia. So I don't think it's fair to say that it's simply a dollar that we're paying somewhere else and the system is just going to be made up with Medicaid. There are many other places that are being paid, including employers and including out of the recipient's own pocket now, and all that's going to be foisted on the states. And so you have Democrat and Republican governors that are very concerned about what's going to happen to their budgets down the road.
I know you're going to tell me you're interested in Virginia, that's your job now, you love your job now, and you're grinning already, but there's a lot of chatter about you and whether or not you have any interest in 2012 seeking the Republican nomination. Do you have any level of interest at all?
I have a great interest in who's going to govern this country because we're heading the wrong direction, and I think this next November we're going to see some changes there. I love being governor of Virginia. I am not running for president of the United States. I want to help. I think there'll be several others of my colleagues, Republican governors, that will probably be seeking that office, and I think that a governor will make a great president. And so I've got 3.5 years left as governor. This is the office held by Thomas Jefferson and Patrick Henry. I'm incredibly privileged to do that, and I've got a lot of big ideas on economic development, transportation, higher ed reform, school choice, a number of things that I want to do as governor of Virginia. It's going to take me 3.5 years to get it done.
All right, let me go around the other side. I didn't get a yes out of you. Is it safe to say I didn't get a no out of you?
I'm not running for president, if that's what you mean.
Do you have any interest in it?
You know, I have an interest in governing. I've been doing this for 20 years. I love getting results, fixing problems.
That's governing.
Making life
Running
better.
for president's governing.
Yeah, but I like doing what I'm doing now, and so I'm not running in 2012. I'm interested in filling out my term and doing some bigger things for Virginia. We're already a great state. I got some big plans to make it better.
Well, you can't say I didn't try.
You tried.
Tried to get the answer.
Well done, Greta.
Thank you very much. Thank you, Governor.
Okay, Greta.
Thank you.
Great to be with you. Thank you.